Hey, welcome to your breakout session on internet addictions, which this includes screen brain syndrome, which encompasses all screen time, and it also encompasses explicit matter, which is very high supernormal stimulus of pornography or sexual media. So if you struggle with one or any or all of them, this module is going to be for you. So there's a brain pattern that I can see in the QEEG brain map assessments that I perform. I call it strained brain. It is a brain map, a brain pattern of too much wired and tired. What that will look like on the brain training headband, on the power bandwidths of the brain waves, the first chart that I showed you, is it will be high beta and likely high theta, unless you also have drain brain, which you can check out the arousal dysfunction breakout session for information on that type of brain pattern, because you might also see that. So strain brain and drain brain tend to come out of screen brain syndrome, which includes explicit matter, internet addictions. On your graph, you have high beta, you also have high theta, or you might have high delta. You might have high alpha. So basically, your brain is running slow and fast simultaneously, or like a pendulum. Sometimes beta's up high, sometimes theta's up high. Look for this in your brain pattern on the power band brainwave chart. Look for that breakout there. Your goal is to decrease beta and to decrease theta or delta, the slow speed and the fast speed. We want to get them down to where they should be on that graph. So we want them low. We want your brain to be in the calm mode on the mind graph that's below the power bands. We want your brain to be able to get down in the calm and stay there and achieve birds. But if you're in strain brain, both the slow and the fast tend to be high, and it tends to be very difficult to achieve birds. Keep using the headband and stay here in Brain Training 101 with me, because every month there's going to be a new lesson on how to bring that beta and theta down to regulate your brain. We're going to cover different topics and themes each month. So this way, we can help heal your brain from screen brain syndrome and explicit matter. If you are still caught up in the screen, it's imperative that you come out, because much of strain brain is created by the loop of going back into the screen, whether that be too much short form media, whether it be explicit matter, whether it be lots and lots of YouTube. It's important for you to come out of explicit matter and moderate the rest. If you need help doing that, please go over to Porn Free Brain Forever, which is designed for explicit matter, but it can be applied to screen brain syndrome. You have to learn how to manage your screen time and stay away from the most damaging of the supernormal stimuli. If you keep desensitizing your brain and basically stringing it out all the time, you're going to continue to have a strung out brain that's in strained brain. It's imperative to put the behaviors behind that keep you stuck in strained brain. In the meantime, you can use the headband to offset it for sure, but it's imperative that you learn to put it behind forever and to moderate screen time in the end. So if you're interested in that program, go over to drtrishleigh.com. It'll totally help you. If not, stay here, Brain Training 101. It doesn't have the complete essential guide of moving you through Unwire, Rewire, and Hardwire, but I'm going to be able to help you month to month. Okay, I hope to see you in that program if you need it. And if not, you stay here with me, and I'll see you in the next lesson.